excited to present today the American Medical Association. And I was a little intrigued by the symbol and wasn't quite sure what it meant, so I looked that up. And the symbol for the American Medical Association is a snake around a staff. It is an appropriate symbol for the healing art, representing wisdom, learning, and fertility. It stands for longevity and the restoration of health. The snake, after all, appears to regenerate by shedding its skin, thereby assuming a new life. The serpent also was considered a potent force against disease and was thought to protect children from epidemics if they touched its skin. So we will now present some information that we found on the American Medical Association.
The American Medical Association was founded on May 7th, 1847. It was founded by a group of doctors in 1847 who were involved with different medical associations, both local and state. One big thing that they wanted to get across is that medical education was not regulated in the US on a national level. The AMA structure contains both internal and external associations. An example of internal users are medical students, academic physicians, and internal medical graduates. An example of external users are the House of Delegates, and they meet at an annual meeting. They also have medical societies that are sent from each state to these meetings. These are just but a few of the societies and organizations that make up the AMA.
So the American Medical Association is known as the nation's most recognized physician organization and represents medical doctors across the country. The following are the requirements to be eligible for membership in the AMA. You must either be a physician who possesses the United States degree of Doctor of Medicine, or MD, or Doctor of Osteopathic Medicine, or DO, or a recognized international equivalent. You can also be a resident physician who possesses the United States degree of MD or DO, or a recognized international equivalent, and are serving in residencies or fellowships. Or a medical student enrolled in an educational program provided by a College of Medicine or Osteopathic Medicine, leading to the MD or DO degree. This also includes students who are on an approved sabbatical, only if the student will be in good standing upon returning from the sabbatical.
The American Medical Association is a professional organization. It offers 4 credit courses to AMA members through its continuing medical education center. These courses are designed to advance medical professional development. The AMA also offers webinars, newsletters, including AMA Wire, and research-based articles to educate its members. Articles range in topics from patient care to tips for medical board exams to medical school survival guides. Leadership training is offered to train members in their career path. The AMA also offers services to its members to educate and improve their lifestyle. Through its insurance arm, the AMA offers various insurance policies, both professional and personal, as well as financial planning assistance. Some of these resources are available for the public on the AMA's website, ama-assn.org. The AMA is an advocacy group. Advocacy is defined by the new Oxford American Dictionary as public support for or recommendation of a particular cause or policy. The AMA is the oldest and largest advocacy group that represents American physicians. In fact, the AMA is a formidable, powerful lobbying force. The AMA's Political Action Committee, AMPAC, contributes money to various medicine-friendly political congressional campaigns each election cycle. In 2016, the AMA spent over $15 million on lobbying. AMPAC helps elect candidates that the AMA works with in shaping federal legislation, such as Medicare physician payment and medical liability reform legislation. AMPAC Campaign School trains members in advocacy and/or political campaigning. The AMA runs awareness campaigns on health issues such as opioid abuse and misuse. Other current AMA lobbying areas of interest include Medicare payment and delivery changes, administrative simplification advocacy, digital health improvements, SAVE graduate medical education, HIPAA compliance, which establishes national standards to protect patients' privacy regarding their health information, FDA issues, reducing opioid abuse and misuse, preventing diabetes, and improving cardiovascular health.
I was looking up the percentage of physicians are in the AMA, but I first wanted to see how many were back in the day. In the 1950s, the AMA represented 75% of the physicians in the United States. The number has dropped to around 20 to 30%. Most of the reasons there has been a drop is that part of the views of most of the members compared to the views of the AMA. We see that there's a small number of members voting on policies and positions that are supposed to represent the views for all collective members of the AMA. We also see that even the members of the AMA, that only 1/3 of members pay the annual dues. So we see that the views of the AMA and the majority of physicians are differing now more than ever.
Policies that the AMA supports improvement in both science and health. With that, they support animal research for biomedical research programs. They do not, however, support organizations that are against animal research. The AMA acknowledges global climate change and how that can have an effect on the population of the world. They support the Affordable Care Act because they believe it is a step enabling Americans to have healthcare coverage.
Oh. Oops. Sorry, everyone. Some examples of policies that the AMA supports include policies that support the appropriate and compassionate use of animals in research for biomedical research programs. The AMA does not support organizations that are opposed to animal research. The AMA acknowledges climate change and supports policies that promote educating the public about climate change's potential adverse health-related effects, such as population displacement, low water supplies, and infectious disease. The AMA supports the Affordable Care Act as a step forward in enabling more Americans to have healthcare coverage. The AMA supports improving on Obamacare in ways that make healthcare affordable to all Americans without compromising quality of care or physicians' ability to determine and offer the best care for each patient. And the AMA supports policies that address and combat disparities in healthcare. Some examples of policies that the AMA does not support include any policies that proposes cuts to Medicare. Although the AMA originally did not support the enactment of Medicare, the AMA now stands by it and does not support any legislation that cuts healthcare costs in a way that would jeopardize the quality of care for patients. The AMA opposes the legislation of marijuana. Currently, the AMA's position is that more research needs to be done to determine if and when marijuana should be used for medicinal purposes. And the AMA opposes euthanasia, more currently referred to as patient aid in dying. The AMA argues that it undermines the integrity of the medical profession.
Most of the information for our presentation came from the American Medical Association's website, ama-assn.org. Other sources we used were the New Oxford American Dictionary, the National Center for biotechnology information, thinkprogress.org, and an article from the University of Washington School of Medicine. Thank you for watching our presentation.